Good morning, I'm Dr. ErikaMason, and I'm going to explain to you what your obstructive sleep apnea means since you've been diagnosed with that. And I have Mr. Airhead here that we can kind of use as a demonstration, and I think that kind of will bring it all together. So obstructive sleep apnea is that you have an obstruction sometime during the night that stops you from breathing. So during the day, Mr. Airhead here shows us that we're just able to breathe all day. We never stop breathing when we're awake. The brain's Johnny on the spot saying breathe, breathe, breathe. We aren't really giving it another thought. It's kind of like we're on autopilot. So that's not the issue. But when we lay down and get on our back or our side, then sometimes what happens, the brain is asleep, that's for sure, but then sometimes we're relaxed, and so what happens is our jaw tends to relax too, and it falls back and will block the airway. And especially if you have a tiny airway, then the tongue is attached to the jaw and then it just blocks it. So you can try to breathe through your nose, try to breathe through your mouth, but nothing's happening. So there's a delay because the brain is asleep, but the brain will wake up, not you eyes open, but the brain will wake up and say, oh, you aren't breathing. So all of a sudden it will start sending signals, and usually the first signal that we see is it sends a signal to your leg and says, move your leg a little bit, and that nudges you enough, like a bed partner nudging you to stop snoring or to turn over or whatever, but it nudges you and you'll take a breath. And so you have some breathings going on again. But then, unfortunately, it will just fall right back. So then the brain says, uh-oh, you aren't breathing again, so let's send a signal again and have you roll over. So that's, if we look at the study throughout the night, you're tossing and turning throughout the night, but it's because your brain is keeping you breathing, not necessarily because your hips hurting or your shoulders hurting. It's because we need to keep you breathing. So one way of fixing this is to put the mask on and to blow continuous positive air pressure. That's called a CPAP. And so we turn up the pressure so that it pushes around the obstruction and gives you air into your lungs. The way I treat patients with a dental device is we just put a piece of plastic between your teeth, holding your jaw forward so that that doesn't collapse like I showed you before, and then we pick a device that we can advance more forward if we need to open up the airway even more. Most of my sleep apnea patients have a tiny little airway, like a little straw, and so with the tongue and the jaw collapsing it, that's the problem. So by holding it and pushing it out of the way, you can breathe on your own pretty easily. So those are the two things that are options. There are other options like surgery and stuff, but hopefully this helps you understand how we're treating your obstructive sleep apnea.